Are you currently in the hospital? Do you have a predisposition to thromboembolic diseases or currently have one? Are you at risk for clotting? Are you currently bedbound? Did you recently have surgery? Have you recently sustained 2nd or 3rd-degree burns? Answering yes to any of these questions could mean that you should be on heparin, also known as Heparin.
Heparin is a well-known anticoagulant and antithrombolytic drug. Heparin should be administered through subcutaneous or intramuscular injections or through intravenous catheters. Heparin is used to treat the development of venous thromboembolisms, pulmonary embolisms, and a variety of thromboembolic disease. It can also be used prophylactically to treat burn patients and prevent clotting. Along with this variety of uses, heparin can be used as an IV flush to maintain flow of IV catheters, commonly known as a heplock.
Nurses should be aware that since heparin is such an effective anticoagulant, the following lab results should be monitored: platelet counts every 2 to 3 days, potassium levels for drug-induced hyperkalemia, ALT and AST for indications of liver damage, APTT before and during IV therapy, and PTT that is below 2.5. The control is acceptable as long as there is no signs of hemorrhage.
Heparin is contraindicated in patients who smoke. Cessation counseling should be given to patients before therapy because nicotine will decrease the effectiveness of heparin. Patients also should not take the drug if they are on NSAIDs, aspirin, clopidogrel, diprimidol, some penicillins, and other thrombolytics like warfarin. Other drugs affecting platelet function should also be discontinued because there's an increased risk for bleeding. Concurrent use with digoxin, tetracyclines, and antihistamines will decrease the effects of heparin and are therefore contraindicated. If a patient is exhibiting signs or symptoms of heparin toxicity, protamine sulfate can be administered to counteract the effects of the drug.
While administering heparin, nurses should be on the lookout for bloody stools, presence of abnormal bleeding and increased bruising, and restrict the use of hard bristled toothbrushes and electric razors. Common side effects while taking heparin include drug-induced hepatitis, rash, bleeding, heparin-induced thrombocytopenia, anemia, osteoporosis for long-term use, fever, and hypersensitivity, including chills, fever, and rash. Signs of heparin-induced bleeding include bleeding gums, nosebleeds, abnormal bruising, black stools, hematuria, sudden decrease in hematocrit or BP. Long-term use of heparin can lead to life-threatening heparin-induced thrombocytopenia. Heparin can also cause skin breakdown and atrophy at the injection site. If any of these side effects occur, please contact your provider for further instructions.